Often, people who snore or suddenly wake up at night gasping for breath. Either our sleep apnea machine isn't working or our BiPAP isn't functioning properly. Hello everyone, myself Dr. Lovkesh Mittal, your sleep specialist. Today we will talk about a very common topic, sleep study. How is a sleep study conducted? Why is a sleep study necessary? What are the different methods? And how many types of sleep studies are there? So, what is a sleep study and why is it done? Let's talk about that first. Often, people who snore, who have trouble breathing at night, who can't sleep on their back and have to turn to the right or left side, have to get up at night and go near the window. When they wake up at night, they suddenly feel short of breath and then have to walk around for 15 to 20 minutes. Such people require a sleep study. In a sleep study, we generally look at parameters like oxygen levels, AHI scores, and what is called the apnea-hypopnea index. Apnea means a pause in breathing, while hypopnea means a reduction in breathing activity. So, when both of these things are considered together as one index, if the value in our sleep study is more than 5, then it is dangerous for us and we need medical treatment for it. So, how should this sleep study be conducted and what are the different levels? Sleep studies are generally divided into 4 levels. Level 4 sleep study is usually done just by checking our pulse oximetry levels, which is typically available in our smartwatches. Level 3 is where we also look at AHI scores and RDI scores. This device is attached to one fingertip for our sleep study, and we can even order and conduct it at home online. A good company is ResMed. They have a sleep test that costs around 1,500 to 2,000 rupees. It's a screening tool, so for people who feel they might have an issue, you can check with that and even share the report with us. Then there is the online level 2, which is generally done at home or in hospitals. In level 2, your pulse, oxygen, airflow, chest respiration, abdominal respiration, EEG, and eye movements are all monitored. In such cases, this is considered a very good sleep study. Level 2 is a recognized sleep study, and based on its results, we can recommend CPAP or BiPAP therapy. Generally, such recommendations are not made on the basis of a level 3 sleep study. Many people do all these things online by themselves, but they don't get the results we expect. So, level 2 sleep studies are generally set up at your home. There are 2 types of level 2 sleep studies. One is titration and the other is without titration. With titration, you are generally titrated with CPAP or BiPAP, and your sleep problem is monitored in real time to see how much benefit you are getting. Obviously, level 2 with titration is considered a very good sleep study compared to without titration. With titration, we can determine whether the issue can be resolved medically or if surgical intervention is needed. After COVID, it has become quite common for level 2 sleep studies to be done at home, and you can have them done at home as well. A common concern that all our patients have is that a technician has to stay at their home, which sometimes raises safety concerns or makes them feel uncomfortable. In such cases, we can also do this level 2 sleep study in the hospital, but the expenses are a bit higher due to the hospital's infrastructure costs. After that comes the level 1 sleep study. When we find significant issues in level 2, we do level 1 sleep studies in a controlled environment inside the hospital with full monitoring and large infrastructure machines to cross-qualify the findings. Level 1 sleep studies are often done when either CPAP or BiPAP is not working, or if we need to move towards surgical intervention, or if our EEG monitoring is not working properly, or if we need to rule out any infrastructure problems that are occurring at home. Sometimes we even have to do this under sedation, and we do it within the general hospital infrastructure. Level 1 sleep studies are always done in the hospital and never at home. After these sleep studies, a report is prepared, as I mentioned earlier, where the oxygen levels are checked. The minimum oxygen, the average oxygen, and the mean oxygen levels are all monitored. If the minimum oxygen level drops below 90, that's a danger sign. If our AHI score is above 5 or our RDI score is above 5, that's also a danger score. So if you are experiencing any such issues or problems, contact us at the numbers given below. Follow us for regular updates. Thank you.